even it is more constricted than a class 2 case. So how to deal with these challenges? We start with the timing. Should we treat any class 3 case? In the class 2, we took the 6 millimeter overjet as our reference. What about the class 3? Are you going to treat any class 3 case? Depending on what reference. Why you are going to decide, I'm going to do the thesis now for one case, or I want to delay the treatment on the other case? What will be your reference? What do you think? If you have a case of class 3 and the age is 9, and another case 12, the third case 16, which one you are going to start with? I need your help. It depends on you have positive overbite or not? So if you have a class 3 with overbite tendency, are you going to treat that case? Class 3 with overbite. Are you going to treat that case once you have it in the practice? Or maybe it's better to delay the treatment? So in such cases, no. I will not go on the case. I will wait. And I will establish good habits. Lip seal, nasal breathing. On the other hand, if I have a class 3 with anterior positive overbite, which means I have a crossbite. So this should be treated once diagnosed, because we have crossbite. But while you are discussing that with your patients, you need to remind them that they will need 3 phases of treatment. You will do phase 1 at the age of 9, then we need to evaluate the case at the age of 12, 13, to see the need for phase 2. And in some cases, you need even to evaluate the case after the age of 16 to see the need of phase 3, because it's related to growth. It's not under your control. Remember, 3 challenges: sun, growth, unwanted forces. Okay? So this is my protocol. Again, what's missing in our profession is management. So we need to manage when to see our patients as consultation and when to start the treatment. So this will help you to have the right start with your patients. So this is for the timing. Now we know when to start the treatment. For the case selection, I would prefer to start with normal growth, and the upper anterior teeth, they are not compliant, the lower anterior teeth, they are not compliant, we don't have intercompensation, and the patient can bring edge-to-edge bite. And we need to examine the patient in centric occlusion and centric relation. For example, if this is your case, is this orthodontic or surgical case? If we have a surgeon now between us, and this is his case, and the age is 24, what's the treatment plan by the surgeon? Compare profile, he will evaluate it as skilled class 3, adult patient. This patient will need orthographic surgery. This is the opinion of surgeons. But again, this is centric occlusion. So ask your patient to bite in centric relation. Are you going to do surgery for that profile? Of course not. So if you evaluate the profile in a centric occlusion, maybe you'll go for surgery. This is wrong. You need to evaluate the profile in centric relation. So the profile is normal. So this is a recorded case for you. So let's start with phase 1 treatment. Younger children, once diagnosed, if you have positive overbite. This is Judy. She is 9 years old and she has anterior crossbite. She has concave profile and she has positive overbite. These are the intraoral photos for Judy. If this is your case, what's your plan? Are you going to put brackets? I will tell Judy, look Judy, your dad will pay $1,000 for your treatment. So why not to help your dad to save some money? Why not use that tank depressor 2 hours per day for 2 months? By this you will save $1,000. This is in front of the parents. So the parents will be more than happy to save money. So they will stay consistent or instructing Judy, put the tank depressor, put the tank depressor. Okay, we want to save money. Okay? And later on, after 3 months, we fix the problem. So if it is initial class 3, you can jump the by tank depressors. And this is the same case after 3 years. So it was only tank depressor and no money was spent on the case. So make it simple. So this is in 3 months, so 2 months, and this is after 3 years. So it was a stable result. And it was reflected on the face. So she's doing well. That's why I'm moving her case till the age of 16. So this is within 2 months, and this is her profile at the age of 13, after 3 years. On the other hand, in Salma case, we are doing routine consultation as usual. So this is her panoramic X-ray. If you go back, do you see any class 3 malclusion? It's not related to the topic, but you see that later on, intraoral. But let's start with the panoramic X-ray. If this is your patient, do you see anything abnormal? What's the red flag in that X-ray? Too many things. Number 1, she has conjunctival missing 5. And what about this canine? Compared to the right canine. So what you are going to do? Her age is 9. What's the most important decision to do by you as orthodontist or pediatric dentist? You have a case like this. 9 years, dentistry impaction of upper canine. What to do? Preventive extraction of upper C's. It's a must. Once you extract the upper C's, the percentage of self-correction of the upper canines may exceed 78%. So the right timing of early extraction of retained C's, See what will happen? We did that. You see the amount of self-correction. So you need to interfere in such cases to guide the teeth eruption. And I'm doing follow-up for hair bite, so this is hair bite. And that canine was erupted. She has a cross bite. I gave her tongue depressor. She didn't put that tongue depressor. So I told the parents we needed to put braces on her. So the mother told me, give her the last chance, give her the last chance. So I needed to add deep grammars on our left lateral and canine. So she would bite on them like this. So it's minor cross bite, so no need for braces. Still, she is under follow-up. On the other hand, if you have a case like this, Yara, she's 9 years old, she's living in Dubai or Abu Dhabi, and they proposed face masks. Do you think children, they like face masks? By the way, what's the aim of face masks? Why do we need face masks? Why you need face mask? The face mask has no wireless, let's say, connection to the arch, has no magnetics, has no magic. It has only one function, to hold the elastics. So it's about elastics at the end. So if I can apply elastics using braces, why do we use that big, sorry to say, ugly device for our children? So they traveled all the way from Abu Dhabi to Jordan just to avoid face masks. And she has a concurrent profile. She's showing the lower incisors, not the upper incisors. And these are the intraoral photos for Yara. She's 9 years old. And the upper arch is not constructed. That's why no need for any expanders. And we decided to help her. So we bonded her case. At that time, it was Q. So I fled the retrocline toe. So now it's procline toe because it's flipped. I added deep grammars on the lower two centrals. I'm creating space for the canine. I'm applying buccal plastic elastics. It's better to use Bellaton plastic elastics. And this is the day of bonding. And this is her case after 2 months. She traveled back to Abu Dhabi, then she came back. So we bonded the laterals. We are now in the Cersei wires. And I finished her case in 1 year. So now she is 10 years old. Then I saw her after 1 year. Now she is almost 11 years old. Then I saw her after 4 years. Now she is 15 years old. So it was stability, just 5 braces. So the job of the face mask is this, elastic. So if I can use the procline torque of lower incisors as my face mask, why to use that extraordinary device? So a deep grammar, we shifted the bite. So from day one, she will leave the practice with edge-to-edge bite. So she entered the practice with concave profile. She left the practice with a straight profile. And within 2 months, we can jump the bite. Now we are in the Cersei wear. And like in class 2 cases, your braces, they can do space maintaining or regaining. And we finished her case within 1 year. The same patient at the age of 11, at the age of 15. So the case is stable. So that shift in hair bite in one visit. Hair follow-up visit after 2 months. Cersei wires. Debonding at the age of 11, at the age of 15. And if you check her lateral sap, it was true skeletal. very comparable to the face mask that has only one job, to hold the elastic. We use elastic. So this is her case within 1 year of treatment, and this is her profile after almost 4 years at the age of 15. So even her facial features, they are improving. She's growing, she's happy, and you need to do even phase 2. And now she is showing the upper incisors, not the lower incisors. So it was good improvement. By the way, do you remember the effect of procline torque on upper incisors in class 2? It was proclination and intrusion. It's the same for class 3. So it will do what, because she is showing lower incisors, and now she is showing upper incisors. So the procline torque on lower incisors will do this. So again, it will do proclination and intrusion. So it will hide the lower incisors. So her case was treated using Damon Q at that time. What about Damon Ultima? Let's take Nahla. Again, she has concave profile, she is 11 years old. Her parenting teeth, they are erupted, but I don't want to make the full comprehensive treatment. I just want to bypass the crossbite at that age. So I bonded her case using Damon Ultima. That's why you know the difference now. With Damon QQ2, you need to flip the brackets on the lower incisors. Low torque, if you flip it, it will be procline torque. With Damon Ultima, you don't need to procline you don't need to flip any brackets. And by the way, the power of procline torque of Damon Ultima not comparable to Damon Q2 or Q2. More powerful, and it's the best in the market. So this is the bonding session. We bonded her case using retrocline torque on the uppers. Even the center was neutral, and procline torque on the lowers. And the rubber bands, they were volatile. And within one follow-up visit, we shifted her bite, and within 10 months, I finished her case without the need of expanders or face masks. Just early bilateral elastic elastics and anterior deprogrammers. Space maintaining and regaining. You can do overcorrection. This is the shape of my anterior deprogrammers on lower two centrums. I'll try my best to push her case till the age of 16 to do the final phase 3 treatment. So we will shift her bite from a negative overjet to almost edge-to-edge bite from day 1. And that treatment will be reflected on her profile without the need of any extraoral device or heavy forces. Big change in her profile. If you want to have active retention and you want to establish nasal breathing, you can use the same theory of Rolf Frankel, functional appliances. So you can use brace P3 in order to have the flanges pushing the upper lip while you are holding positive over jet. So you can ask your patient to use that device as a retainer at the same time. This will improve oxygenation and this will give you good effect on the muscles of the face. It is like Frankel 3, by the way. So this is for phase 1. So you can help your patients. And by the way, this is very good marketing tool for you, that you are not using face mask. Like Yara, they traveled all the